I think we're seeing right now that the entire world was unprepared to have as much PPE as needed. Some places are facing far greater shortages than Canada. We have worked extremely hard to step up both in our procurement of PPEs, but mostly on increasing the Canadian production of personal protective equipment and materials like ventilators and testing kits. We recognize that this is something that we're incredibly lucky that Canadian companies are stepping up, and in the coming weeks we will have secure supply for many of those products from here in Canada.
So here's what's new today. The federal government is now teaming up with 4 Canadian companies to produce up to 30,000 ventilators, which are, of course, a critical piece of life-saving equipment, especially where this virus is concerned. That's 6 times what Canada's hospitals currently have. Also, more than 20 companies are now helping to make medical gowns. That includes the retailer Canada Goose and a company that makes airbags. But knowing the pandemic could last months, even up to 2 years, Canada is also competing for supplies abroad. 500,000 surgical masks are on their way, according to the federal government, from a 3M facility in the United States. That shipment was initially blocked after U.S. President Donald Trump ordered all of those exports to stop. But a deal has been reached between 3M and the U.S. to continue supplying Canada. Canada also received 8 million surgical masks from China yesterday and ordered an additional 230 million of them. This country has also ordered 113,000 liters of hand sanitizer. Most of that, they say, will be expected to arrive this month. But ordering those supplies can also be a lot different from actually getting them delivered. The Deputy Prime Minister described the global market today as the Wild West. So how soon can these Canadian companies get medical equipment like ventilators off the assembly line? And when will international orders arrive? Anita Anand is the Minister of Public Service and Procurement. Hi, Minister. Good to see you. Thanks for making time for us.
Thanks for having me.
Minister, I want to start on N95 masks and procuring them for this country. Those, of course, are the masks that frontline workers wear. They're the ones not surgical. They're the ones that keep out 95% of the particles and that help those frontline workers in treating people who do have COVID-19. You said earlier today that the federal government has ordered 75 million of them. Can you describe for us how difficult it is to get them to this country right now? What are the sort of challenges you're up against?
Certainly, Vashi. We are facing a very tight international market at the current time, meaning that demand for PPE and the N95 in particular is very high. And in addition, the market is very volatile. So once we order a good, it's always important for us to keep our eye on that good and make sure that it makes its way to Canada. So what do? We work very closely with teams on the ground in the country where we are doing the procurement to ensure that that product is going through the bureaucratic channels and then ultimately making its way via air transport or otherwise back to Canada. In China, for example, we are working closely with Ambassador Barton and his team to make sure that goods get to warehouse. We have a warehouse in Shanghai that we have made sure is available for goods there. We are also working with private companies in China to evaluate the goods, to assist us through the bureaucratic process. And ultimately, we're sending planes over to China to make sure those goods get back to Canada. Already this week, 2 planes have come back to Canada with goods, and we're expecting another one this week.
How much of can you describe, I guess, for us, the portion of the PPE, of specifically even these 75 million masks that are coming from China? Is it all of them?
The bulk of masks this week, yes, are coming from China. And in addition, we have masks, as you know, coming from the United States via that 3M order. So 500,000 masks coming via the border with the United States, which should arrive here in Canada this evening or tomorrow.
And on the 3M issue, because of course that's what we've been talking about over the past few days. Last night, the president announced that the United States had reached an agreement with 3M. We found out later via 3M that meant that those masks you just referred to could come to this country. Has the federal government, though, secured a complete exemption from the export controls the president issued on PPE?
What's so important to remember is that this is procurement like we've never done it before. We are working 24/7 using all diplomatic channels to make sure that goods that we have ordered and procured make their way back to Canada. In the case of 3M, we worked very closely with the American government on launching a full court press to make sure that those goods came back to Canada, and we are prepared to do that again with other corporations and other suppliers in the United States and outside of the North American continent if need be.
With respect, Minister, does that mean that the federal government has to operate on a case-by-case basis and can't secure a full exemption from the types of controls that the White House administration has levied?
As I mentioned, the situation is quite fluid, and we are continuing to negotiate with the United States government and other territories in order to ensure that the goods get back to Canada. And so with this fluid environment, the conversation is ongoing.
So there isn't a full exemption secured?
At the current time, we're still in negotiations regarding a number of items.
Okay, understood. Let me ask you about China, because last night we had the CEO of NYX, sort of an intimate apparel company. She had started up a charity effort to secure a number of PPE, and she was describing, I mean, she's getting it out, but it's very difficult, and she was describing especially increased controls, she said, in China. The owner of the factory, for example, that she had procured a number of these items from was arrested a couple nights ago. Is the Canadian government, and I take your point on all the efforts you're making in China and through the embassy, but is the Canadian government concerned about export controls in China?
Let me tell you what I do every day, Vashi. I make sure that our team is out there procuring goods from China and around the world. And we have a heightened level of concern regardless of the jurisdiction because of the tight demand, the heightened demand, the fluidity of this market for getting goods back to Canada. And in China, our concerns relate to making sure those goods pass the bureaucratic channels that have been implemented recently in China before goods can leave that country. So there is concern, but that concern relates to all of the goods that we are procuring because we need to get them back here to Canada and in the hands of frontline healthcare workers who are working so hard to protect everyone struck by COVID-19.
What about quality control? What can you tell our people watching, Canadians watching right now? They've just heard the City of Toronto, for example, say that they're recalling 62,000 surgical masks after discovering that they don't meet standards and specifications. And those masks were actually sent to long-term care workers back at the end of March. What kind of quality controls are in place, and have you had to increase resources because of the current fluidity that you described?
Remember what I said initially, that we are launching a full court press, doing procurement like we've never done it before. And this is one example of the way in which we are ensuring that goods get back to Canada. In China, for example, we have retained firms to ensure that we have quality control on the ground in China. Then once the goods get back to Canada, the Public Health Agency of Canada has the responsibility to go through the goods to make sure that they are up to spec before they are distributed out. So it's really a two-tier process to make sure that we are able to meet spec and get those goods out to frontline healthcare workers in good form.
So do you know why those 62,000 masks were found to be eventually defective? Do you know anything specific?
I have no idea. I've been in a meeting all afternoon. My apologies.
Okay, no problem. And on the last part of your announcement today, or the big part of your announcement, I should say, the last part of this interview on the ventilator, the sort of switch from procuring from outside of this country to domestic production, 30,000 ventilators. Is there, I heard of a variance of timelines from government officials, including the Prime Minister. It could be days, weeks, or months. Which is it? How long until even some of these ventilators are actually made and in use?
Let me start by saying that we are running at the same time complementary channels of supply. That is, we are seeking international procurements at the same time as domestic procurements. And so on ventilators, on masks, on gloves and gowns, we are working very hard with multiple suppliers, leveraging existing supply chains and meeting up and contracting with new suppliers so that we can make sure we have voluminous goods to distribute to the healthcare system. On the subject of the 3 companies that are going to be making ventilators for the Canadian market, we are very confident that in the short and the long term, we will be able to rely on these firms for ventilators. The timeline is evolving, but Minister Baines this morning put a very short timeline on that, being weeks and months. So we're very hopeful that these negotiations and contracts can continue to yield positive benefits so that we can run domestic and international supply chains in tandem to make sure that we get the goods back home where they need to be.
I take your point on the veracity of the agreement, Shirley. I guess what I'm wondering, and the reason I'm asking if it's weeks or months, and maybe there isn't a clear answer at this point, I am asking, though, because time, as we look at these numbers, we see the modeling from Quebec, et cetera, time is really of the essence, right? The number of patients in the ICU who need to access a ventilator, it's a lot different in the weeks versus months. So is there a way to ascertain whether or not some of these ventilators will be ready 2 weeks from now?
Vashi, what we have to remember is that there is an existing stock of ventilators in Canada at present, and that number is at about 5,000. In addition to that 5,000 number, we also have international procurement contracts for the supply of ventilators, and so this domestic retooling, building up domestic capacity, is in addition to what we already have. And so we have to remember that there are multiple supply chains operating at once, and we are doing our level best to get things completed and out to frontline healthcare workers as soon as possible.
Okay, I'll leave it there. Thank you very much, Minister. Appreciate your time this evening.
Thanks so much, Vashi.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.